A lateral raise is a great strengthening exercise if you're wanting to focus on shoulder development, and it's quite easy to learn. I'm going to discuss the main muscles involved in the lateral raise, different types of equipment that can easily be used at home for this exercise, and variations of the movement. I'm Dr. Elise Brown, and I'm a scientist who studies how exercise can help prevent and slow the complications of diabetes. The lateral raise is a single joint vertical shoulder push exercise that occurs in the frontal plane, and the movement is shoulder abduction and adduction. The main muscles involved in the movement include the supraspinatus and the deltoid. The supraspinatus controls abduction for the first 15 degrees, then the deltoid takes over for the next 15 to 90 degrees. The supraspinatus is still assisting the deltoid during the 15 to 90 degrees of abduction, and both muscles play important roles in maintaining shoulder stability. Two ways to easily perform this exercise at home is by using dumbbells or resistance bands, and muscle activation in the medial deltoid is going to be similar using either piece of equipment. In a standing position with heels under the hips, chest squeezed upward, and light dumbbells in each hand, start with your arms by the side and hands facing the body. With soft elbows, about 5 degrees of flexion, begin to raise the arms out to the side until the hands are at about shoulder level, and then lower them. When raising the arms, make sure that you're not shrugging your shoulders. Try to pull your shoulder blades down while raising the dumbbells. Exhale as you lift up and inhale as you lower the weights. Make sure that you avoid rocking back and forth, as we want these to be controlled movements. It should be the deltoids moving the weights and not your hips. If using resistance bands, place the band under your feet. Bands can sometimes be a little tricky with placement, as we want to have some resistance throughout the whole movement. If the band is too long and you're not feeling resistance at the beginning of the movement, you can either change your foot placement, hand placement, or even switch to a unilateral movement. The lateral raise can be modified based on the rotation of the upper arm, and this will affect which part of the deltoid is activated more. We just covered a neutral position, but these can also be performed with the arm rotated outward or inward. The anterior deltoid is going to have greater muscle activation when the arm is externally rotated. The medial deltoid has greater activation in a neutral or internally rotated position, and the posterior deltoid will be activated more when internally rotated. The lateral raise can also be performed with elbows flexed at 90 degrees. Since the dumbbell is held in front of the body, this position causes greater activation in the anterior deltoid when compared to the neutral and internally rotated position with arms straight. The lateral raise is most commonly used to focus on the medial deltoid using dumbbells or resistance bands, but you can influence which part of the deltoid is being emphasized by manipulating shoulder and elbow positions. Thank you for watching.